Hello, today 4th February is World Cancer Day, and today I thought I'd speak to all of you regarding fertility preservation in gynecology. Now, when we talk about cancers of women, we have breast cancer, ovarian cancer, endometrial cancer, which is cancer of the lining of the uterus, and cervical cancer, which is the cancer of the mouth of the uterus or the birth passage. So, whenever we deal with cancers in women, there are 4 things which we need to keep in mind when we are dealing with their fertility issues. Firstly, the nature of the cancer and the type of cancer, the duration for which they have been affected, definitely the location of the cancer, and whether they have received any treatment for the said cancer before, like chemotherapy or radiotherapy in the past. This is because the age group of women also plays a very important role in determining their fertility potential. For instance, if we are dealing with prepubertal ladies or young girls, the treatment is different compared to if we are dealing with somebody in their middle ages or the middle age group. So the various modalities which we have when it comes to middle age group women whom we deal with in our day-to-day practice and the options which we have are either oocyte cryopreservation or embryo cryopreservation. So oocyte cryopreservation is usually preferred in unmarried ladies or single women who do not have partners, whereas if the lady is married or has a partner, we would prefer embryo cryopreservation, in which we take the oocyte from the lady and the sperm from the husband, and then it is fused and converted into an embryo, and this embryo is preserved in liquid nitrogen at minus 180 to 190 degrees, where it can be stored at this temperature for many years altogether, and it can be transferred back into the uterus of the lady once she has successfully completed her chemotherapy or the said treatment whatsoever. So usually in terms of success rates, we usually see around a 70 to 80% success rate with embryo cryopreservation. However, in younger ladies who do not have partners, we might have to go for an oocyte cryopreservation, in which we employ the technique of superovulation, where we give certain drugs to the lady so that she produces number of oocytes or eggs in that cycle, and they are retrieved and then stored in liquid nitrogen in the similar way as the embryos are stored. In younger women or in unmarried ladies or those who are prepubertal, we often face certain tumors known as germ cell tumors. So they usually present at a much younger age group, maybe around 16 to 18 years of age, and for those patients we might have to employ an approach known as ovarian transposition or ovarian transfixation, in which a certain part of the ovary is removed surgically and it is stored in liquid nitrogen, and once the treatment is completed, it can be transferred again into the human body. In the similar way, if we talk about other cancers like endometrial cancer, they might manifest in younger and middle age group women as well, and in those who want to preserve their fertility in early stages of endometrial cancer which has not invaded the uterine wall or the myometrium, we can offer non-invasive methods such as using a drug called medroxyprogesterone acetate, which is available both in the form of tablets and in the form of a coil, which we usually call as the Mirena intrauterine system or the LNG intrauterine system, in which we use high doses of these hormones, that is medroxyprogesterone acetate, for a period of 6 to 12 months, and at every 3 or 6 months we would like to call the lady back for an endometrial biopsy or an office endometrial biopsy, and we send that for histopathological analysis, and if we see that there is a regression or there is no change in the endometrial nature, we can go ahead with the same treatment as long as she wants to continue her fertility. However, if there is any deterioration in the endometrial histopathology, then we would have to tell her that unfortunately fertility sparing is not the correct approach for her. Similarly, in cases of cervical cancer, in early stages, there have been lots of advances in fertility preservation, and we can employ techniques such as loop electrosurgical excision of the transformational zone, in which a certain area of the cervix, the unhealthy or the malignant portion of the cervix, is removed, and then the lady can of course continue her fertility, and then we can plan the future treatment accordingly once her fertility has been completed. In terms of ovarian cancer, as I have already spoken about germ cell tumors, there are a certain category of tumors called borderline tumors, which is between benign and malignant, in which we don't know whether the tumor is really malignant or not, but it has a high chance of converting into malignancy in the future. So in these cases, what the guidelines say and what the recommendations say is we might offer the lady a surgery, either laparoscopically or open, remove a small portion of the unhealthy looking tissue and send it for frozen section, and if at all there is any suspicious area, we might decide to remove one side of the ovary, what we call as unilateral salpingo oophorectomy, removing one side of the tube and ovary, and of course preserving the other tube and ovary so that she can complete her fertility. And once the fertility potential is completed, we go ahead with a completion surgery. Similarly, as I've spoken about the germ cell tumors, although they are usually seen in a very young age, they are very chemosensitive, and there are lots of new drugs which have now come into the market which are very potent. For instance, we call them BEP drugs such as the bleomycin, etoposide, paclitaxel. They're very potent drugs, and usually when we give 3 to 6 cycles of these drugs after surgery, the cancer is absolutely cured, and the lady after marriage, she already has one functional tube and ovary, and she can definitely complete her family in the future. So this was in brief a discussion regarding the various cancers of the female reproductive tract and their management and the fertility preservation. I would urge you to discuss and deliberate any issues with your local physician, gynecologist, and discuss further, as the treatments have become very advanced, and with newer chemotherapeutic agents, the lifespan and the 5-year and 10-year survival rate has increased manifold in cancer, and so the doctors and physicians can help you in the best possible way. If at all you wish to consult our team of doctors, we have an excellent team of physicians, embryologists, and counselors at our institute, and you can always consult the team at Birth Fertility Clinic either at Elgin Road, Salt Lake, or Chandan Nagar for any further help or advice. Thank you.